Welcome to this week's edition of Rick Wolf's Sports Edge. I'm your host, Rick Wolf. For more than 60 years, ever since kids started to play Little League Baseball, there have been countless articles published by the top surgeons in our country that kids who throw curveballs are running a huge risk of hurting their arms. And along the way, there have been countless major league pitchers and pitching coaches who have also warned youngsters about the dangers of throwing curves at a young age. Sure, the temptation is there for kids to do this, but warnings about injuring one's elbow or about damaging the growth plates in one's arm and so on have caused coaches and parents everywhere not to let kids go out and throw curves. But now, Little League Baseball, an organization that for the last few years has been faced with the quandary that all of its kids on TV throw curves and sliders, is that, well, guess what? They've done a study that shows that throwing curves at a young age does not pose any risk to kids. What? I repeat, what? And this is good news, and I say this sarcastically because this announcement comes just as the Little League World Series is about to start. That's good news because Little League coaches can now urge their kids under the age of 13 to go out and throw dozens and dozens of curveballs in a row. Why? Because Little League Baseball says there's no evidence that kids will hurt their elbows. Now, you have to understand my skepticism. This proclamation flies in the face of more than 60 years of medical research that urges parents and coaches not to let their kids go out and do this. That the physical torque that's put on their developing growth plates in their arms and shoulders can only spell bad news. And what does Little League Baseball say in its press release? They claim that the reason why kids complain of sore arms and hurt elbows comes not from throwing curves, but rather because kids who pitch in Little League all pitch on travel teams. And since Little League can't control pitch counts for those kids who are on other teams, that's the reason why they hurt their arms. In other words, it's overuse, not throwing the curves. So Little League is saying, at least the way I read this press release, is that it's okay if your kid, A, only pitches for Little League where pitch counts are kept, B, that throwing curves all the time does not pose a threat, and C, and I'm quoting here from the release, quote, some within the baseball community have advocated for a ban on curveballs. However, the study conclusions do not clearly support such a ban. Furthermore, a ban on breaking balls would not be simple to put into practice. How does a volunteer Little League manager, coach, or umpire know when a kid is throwing a curveball? What, are you kidding me? I mean, this is unbelievable. Anyhow, join me this morning to talk about this new study by Little League Baseball. Kremchek, who is one of the nation's leading orthopedic surgeons. In fact, he serves as the medical director and chief orthopedic surgeon for the Cincinnati Reds baseball organization and has done so for several years. Dr. Kremchek, good morning.
Good morning. How are you?
I am fine, thank you. And thank you for getting up early on this Sunday to talk about this unbelievable announcement from Little League Baseball. First of all, what is your overall reaction to this?
I was shocked, embarrassed, shocked. I couldn't believe it. Of all the years that, and I've been doing baseball for 20 years, with the Cincinnati Reds for 15 years, and I've really been studying baseball all my life, since I was a little boy, but really studying it since I became a physician. I didn't know what to say. I was speechless because my first reaction was the politics of Little League Baseball was getting in the way of our youth and preventing injuries, and a crusade that we've been on for 10 or 15 years to protect our youngsters, and in particular our young baseball players.
Let's get into this. The Little League Baseball cites that their findings, their conclusion are based upon findings of a 5-year study conducted by some specialists at the University of North Carolina. Did you have a chance to look at their research?
I did. I've looked at all this research over the last 10 years on breaking balls and mechanics of little leaguers throwing, and absolutely I have, yes.
And what's your sense of what they've come up with here?
My sense is that, number one, is I don't think that they proved that curveballs do not cause problems. I don't think that they could prove that they could. And that is one small amount of evidence in a small group of kids over a 5-year period, which is really not a very long period of time, because we all know that throwing balls and the stresses of a pitcher's arm, especially our little leaguers, don't necessarily cause problem when they're little leaguers, but can cause problem years down the road. So when kids that are 12 and 13 years old want to go play high-level high school or college baseball, that's when many of them can get into trouble. So I don't think it's long enough study, number one. Number two, I don't think it's enough kids. So I don't think this has proven anything, and I think Little League took this little bit of information and has run with it for political reasons, and that, to me, I'm embarrassed by that.
Well, you know, if you take a step back on this, and by the way, friends, we're talking with Dr. Timothy Kremchek, the medical director and chief orthopedic surgeon for the Cincinnati Reds. If you take a step back on this, and over the last few years, it's very, very obvious that when you watch anything with the Little League playoffs or World Series, every pitcher out there under the age of 13, every one of them is throwing curveballs or sliders, or as ESPN's announcers all universally call them, they call them breaking balls. So euphemistically, that's not going to, that somehow it's going to change the complexion of what they're doing. But all the kids throw curves, and clearly ESPN and Little League must have been say, well, what do we do to get around this? And so now they've come up with a study that says, guess what? Curveballs do not have any, there's no correlation whatsoever between throwing curves and hurting one's arm. This is, I mean, you've seen obviously thousands of patients over the years with arm injuries. You see, I mean, what when this coming week, when some mom or dad comes to you and says, Dr. Kremchek, my kids had some elbow injuries over the years, but you know, curveballs are fine. That's what Little League says. Well, how do you react to this? How does this affect your practice?
Well, I think it's going to take a lot of more explanation than it has. I mean, again, many of us that see these baseball players or see young kids that play baseball playing over the years to diminish the use of, number one, fatigue. And fatigue, no question, does cause arm injuries in our little ones. Mm-hmm. But the breaking balls, in addition to the fatigue, are very dangerous. First of all, you're going to have to backtrack and you have to explain and basically talk about the politics. And I talk about the politics of Little League Baseball and how it's become a moneymaker and how it's on TV. And you know, even the kids locally here in the Cincinnati area, the Hamilton kids, we're very close again to getting to the World Series, and what a big deal that is. Mm-hmm. And whether it be coaches, fans, you know, people around them. But, you know, you can go back to studies that have been done in the late 2000s and talk about arm pain in little kids when they start throwing breaking balls. And you look at sliders and you look at curveballs and how a high number of or percentage of kids that are throwing breaking balls, that is sliders and curveballs, complain of elbow pain. We know how fragile the growth plates are in our little ones. We know that before you mature, you use your upper body to throw and you don't use your core and your legs, and so how much more stress that places on your upper arm. Mm-hmm. So I think the fact, and I've even gone as far as to boycott around here watching Little League World Series. People ask me. I don't watch it. I think it's sickening to watch these kids throw breaking ball after breaking ball, and parents and coaches who know deep down that it's bad for them are putting that aside for their own personal gain or the gain of the television ratings or the gain of a team going and continuing to win, because not realizing or realizing or trying not to think or rationalizing in this case that these kids are fine. See, they pitched this year and they're fine, not realizing that 5 or 6 years down the road when they need Tommy John surgery or their shoulders blown out, they go back and think, well, geez, I pitched for 2 or 3 years with throwing for time. That's what we think has caused the problem. That's why I think it's irresponsible of Little League to do this, and to me it's very offensive.
Well, we're talking this morning with Dr. Timothy Kremchek about this astounding announcement from Little League Baseball. They're proclaiming that throwing curveballs poses no danger for young kids under the age of 13, which again flies in the face of so much research over the years. I'm going to take a break, Dr. Kremchek, and we'll have an update. But when I come back, I'll take phone calls as well from our toll-free line at 1-877-337-6666. Brought to you by Hot Summer Fun at Mohegan Sun. Create your moment at MoheganSun.com. Stay with me, friends. This is obviously a fascinating and very, very disturbing topic. As I said, I'm eager to get some thoughts and comments and get your general reaction as well. So stay with me. Back with more after these messages.